I want to begin my remarks today by just saying a real special thank you to Senator Harkin and to our colleague from Alaska, Lisa Murkowski. We are from different parts of the country. We are Democrat, we're Republican. A number of things bind us together. And one of the things that bind us together is our personal commitment to healthy lifestyles, to eating the right foods, and to exercising. And
sometimes too much.
Sometimes here's a woman who has a bad knee because of a skiing accident. Here's a guy who broke his foot 2 years ago running a half marathon. So you know these things can. And Tom, here's how Tom's still going strong, and so he's our role model in all of this. But as Senator Harkin suggested, we face an epidemic of obesity in this country of ours. Something like a third of all the kids are either overweight or obese, and I'm told close to 50% of the adults in our country are either overweight or obese. Or obese. And we know that the bad things follow when we're overweight and when we're obese. The propensity for people to become, to have diabetes, to develop diabetes early or late is heightened. The likelihood that we'll have heart problems, the likelihood that we'll have problems with our joints, our knees and our ankles. All of those things we know, and we have the empirical data to say bad things happen when we become very large and we don't do anything about our weight and we go the wrong way. Standing before you today, I could say we'll pass this legislation. My hope is legislation will be part of healthcare reform. A lot of healthcare reform legislation will focus on wellness and on nutrition prevention. This is a great piece of that. But if we just did this piece, however good it is, and I think it's very good, this is all we did. It's not nearly enough in terms of turning the tide against this rising tide of obesity in America. And Tom Harkin and with help from people like Senator Murkowski and myself are working to do other things as well. And I salute Tom. He's working on this for years. But if you look at I think it was in the Farm Bill when we changed the Women, Infant, Children Act, we made changes there to encourage with the use of federal funds for fruits and vegetables. When you go to any school in Delaware, go in there 5 years ago, you walk through the schools in Delaware 5 years ago, you can buy all kinds of sugar soft drinks, almost relatively little water. You go into the cafeterias to see what's being served at lunch, not nearly enough fruits and vegetables, way too much carbohydrates and fats. That's changed in my state. In my state, every high school in my state, every public high school in my state now has a wellness center. All those wellness centers have a nutritionist. And so we're fighting this on a lot of areas, with federal legislation, state by state in our schools, and with the curriculum with respect to exercise and all that. So this is a war that we're fighting on a lot of fronts. One of the things we have done, and one of the things I was involved in earlier, as I suspect of Tom and Lisa, been involved in tobacco, trying to especially to turn the tide against the use of tobacco, and especially with young people. And we've come to the point literally in about 10 years in this country where we have made smoking almost unacceptable, socially unacceptable. And one of my goals is with respect to being overweight or to being obese, we wanted to really turn the tide of public opinion. So that kind of behavior, overeating, that leads to obesity is going to be seen by more and more people as socially unacceptable. Let me just take a minute and we'll look at this chart. You take a snapshot in 1990, a snapshot in 1998, and another one in 2007. Remember this, light blue is really good. That shade of blue is not bad. You saw there's a black right here, mean we don't have the data. This is 1990. The light blue says that fewer than 10% of the people who live in those states were obese or overweight. Less than 10%. And the somewhat darker blue says in the rest of the country, for which we had data, fewer than 15% of the people were overweight or obese. That was 18 years ago. That was 18 years ago. Let's fast forward to 2007. There's one state here that's, I don't know if this is actually 15 to 19%. The state right here, what would that be? Is that Utah? Colorado, there you go. Colorado is really the state that may be in the best shape of all. We don't see any more light blue. We don't see any more dark blue. We have data now on every state. We see a lot of orange. We see this crosshatch here, down here, this orange crosshatch color. Over 30%. Over 30% of the people who live in these states are obese or overweight. The very best states that we can do actually here, besides Colorado, which is 15 to 19% overweight. And the next best states are the states these kind of a tan color, and they're 20 to 24%. And that's good today. And then you go back, gosh, 17 years before that, nobody. Nobody. No, we see none of the same colors here. Nobody was as good. No state is as good now as it was back then. And sometimes the picture is as good as 1,000 words. That's a pretty good picture. That's a pretty good picture. Let's go one more. Let's go back to 1990. About 12% of the folks in our country were obese. About 12% today, and it's almost been steady, almost a steady rise. So by 2017, we're up to, oh gosh, closing in on 30% of Americans are obese. I strongly believe, like Senator Harkin, that consumers should have the tools and the resources that they need to make healthy eating decisions, not just at the grocery store, but also when we dine out. He made the point, we spend about half the money on our food at restaurants these days. And menu labeling is an integral part of addressing the rapidly rising rates of obesity. Many studies show that overconsumption of 100 to 200 calories per day can cause a significant weight gain. 200 calories a day, 365 days a year, is something like 73,000 calories. Think about that. If we overeat 200 calories a day, 365 days a year, I think that works out to 73,000 calories that we have consumed over what we ought to be consuming. No wonder we've gained so much weight. No wonder that we're so obese. With that said, over the past year, 3 of us have worked together with a number of consumer groups, God bless them, the Restaurant Association and Public Health Community, God bless them, to come up with a compromise that provides important nutrition data for restaurant diners and provides the information we need in the same way. I just want to say a big shout out to Darden Restaurants, to the Coalition for Responsible Nutrition Information, the National Restaurant Association, on the health group side, the Center for Science in the Public Interest, the Nemours Foundation in Delaware and down in Florida, for all of your help and for working with us to get us to this point. Very briefly, here's the 4 things that, the cliff notes, if you will, of this legislation. Number 1, calories are going to be printed on menus and on menu boards for chain restaurants that have 20 or more restaurants across the country. Number 2, other nutrient information is immediately available upon request. We go in, we sit down, we see what the calories are on the board, the calories are on the menu. We ask for information immediately. They've got to give us information, whether it has to be sodium, there's sugar, carbohydrates, all kinds of fats. That information has to be immediately available to us as we prepare to order. And the other thing that's of note here, we preempt state and local laws pertaining to nutrient content disclosure. And if they're non-chain restaurants in a particular state that want to comply voluntarily with the state, the federal law, they don't have to, but if they want to, then they can opt in to the preemption clause. Again, I'll close where I started. This by itself is not going to solve our problem with obesity in America. This, coupled with a lot of other things that we've already done and that we're going to do, are a terrific step in the right direction. And Tom, I want to thank you for years of perseverance on this and for giving Lisa and me a chance to work with you. And together, we're going to make a real difference for a lot of young people, a lot of old people who want to be skinny people, and they're going to have that chance. Thank you.